This is the injury report presented by NYU Langone Health. The Giants lost their first game without their franchise left tackle, Andrew Thomas, who's out for the season after he underwent surgery to repair a Lisfranc fracture in his left foot. So let's talk about the injury and AT's recovery with Dr. Latha Jazrawi, sports orthopedic surgeon at NYU Langone. Doc, what's up, man? Long time. How you feeling?
Brad. I'm good today. How are you doing?
I'm great, man. Not after that loss to the Eagles like that, but, you know, I flushed that down. It's time to move on and talk about the Pittsburgh Steelers. But let's get into this Lisfranc injury, Doc, because as you know, I play professional football. I've played against and with guys who've had it, but some of our viewers may not know what it is. So can you break down exactly what Lisfranc is?
Yeah, so the interesting thing with Lisfranc, it comes from a French general who described, he was actually a surgeon, described these injuries that were happening to a lot of the people on the battlefield. And it has to do with an injury in the, what we call the midfoot, where the bones that connect what we call the metatarsals to sort of these smaller square type bones called the cuneiforms in the foot get sprained and or fractured. Now, Lisfranc described it, but in many ways, what it means is that the foot and the foot bones, when you get this type of injury, start to splay or spread out. So when you walk on a Lisfranc injury, fracture dislocation, or some sort of bad sprain and tear, the bones in your foot literally start to spread out. And obviously, that's not good, because if it persists or if the widening persists, you'll develop rapid arthritis. So when this injury happens and there's any amount of displacement in the foot, it's got to be fixed, okay? Whether it's a fracture or not and just a sprain, you got to put screws across it. You got to squeeze those bones together back into place so that the ligaments could actually heal up. So when the patient walks on it again, the bones in the foot don't spread out, leading to premature arthritis. So that's what he had. The original injury, like I said, historically was people on horseback where their foot got caught in the stirrup. And just imagine the front of your foot getting caught in the stirrup and the rest of your body going forward. Your foot would basically, the middle of it would dislocate. And that's essentially what, you know, happened in this injury, where the bones of the foot either broke or dislocated and they moved. So you get him back, put some screws across it. He gets put in a cast. He can't put weight on it for minimum 2 months as this is, you know, healing. And the recovery for this is long, right? Because not only do the bones have to heal, the ligaments have to heal. And we know with ACLs, these ligaments take a long time to heal. So this is going to be at least a 6-month recovery for this gentleman. He's definitely missing the season. He'll be back for next year.
So I remember when Cowboys or former Cowboys wide receiver Des Bryant had it, and then when I was up in Canada playing in the CFL, one of my teammates, Bo Bowling, had it. But those are both wide receivers. They kind of tried to play through it. Andrew Thomas is like 6'5", 328 pounds. Would it have been possible for him to try and play through that?
Well, I don't know the details of exactly his Lisfranc injury. If it was a Lisfranc sprain, you know, those are ones we treat non-operatively where there's no displacement. But that's something that, yeah, he could have either stayed off a week or two, taped the foot, you know, like an ankle sprain where we let people back because it's not necessarily a surgical thing. These are different. The way it was described and the way he went to surgery, that means this thing was spreading out. Okay. And you can't play on that. It's just too painful. And that's the bottom line. How it happened as a lineman, very easy. His foot, either as he was getting into position and being pushed back, got caught in a weird position on the turf or the grass, and basically the front part of the foot separated from the back part of the foot. That's the injury.
So he went down to Charlotte and consulted with a well-known foot doctor down there to get a second opinion. What was that conversation like then for him to be like, okay, we got to shut this thing down for the season?
Well, I think the concept of, remember, the agents who work with these athletes, they're driving a lot of the players, you know, to specific people. And in this case, the foot surgeon who operates on a lot of these NFL players. And I think that's the second opinion, that's driving it. And they go for confirmation because, look, it's a a game, a season-ending injury. So you want to make 100% sure. So I don't blame him necessarily. I'm not aware, did he have his foot surgery down there, Brandon, or came back to New York?
Down in Charlotte. Down in Charlotte. He had last Wednesday.
Yeah, that's how it goes. Once you get a pipeline with these guys, it doesn't mean he's the best. It doesn't mean that the doc that takes care of them and his team couldn't have done the right job. It's just the way it goes. Some of these, agents drive their players to certain doctors.
And plus, he had to be careful when it came to this foot because he's had foot and ankle injuries in the past, and he even got surgery on that same foot or ankle. So could that have affected the most recent injury? And is this something that he is going to have to deal with, but not only him, but the Giants as well in the future?
That's a great question. Look, I don't know what the other injury was. Now, you can make an argument if he's had, scar tissue with limited mobility in the ankle. You can make an argument that the force was transmitted to the midfoot. But those are all, suppositions. I don't know. But I can tell you now, with all these multiple injuries, it is an issue, that on one foot, an ankle, you've had all these injuries. But look, he's had surgery. The idea of the surgery is that you reduce it, at what we call anatomically back the way it was before the injury. And with that and it healing anatomically, that's your best chance to get back to the level you played before the injury.
All right, Doc, thank you. Our viewers are going to walk away from this thing a lot more educated than when they came into it. So thanks, Doc, and have a great day,
Thanks,
man.
Brandon. Have a good one.